Welcome everyone to the Center of Excellence for Infant and Early Childhood Mental Health Consultation conference entitled Equity from the Start. My name is Angela Keys and I will be your session moderator. I'm joined today by Allison Hargarden and Lisa Schluter. I'm sorry, by getting a little ahead of myself. I was so excited to welcome, I should be introducing Amber as our technical moderator. The session is being recorded. Transcription is available through the Zoom platform, and should you have any questions, please feel free to relay your questions in the chat. We will have some time at the end of the session for questions and answers with the presenters, but we will also, if your question comes up and you would like to put in the chat, you can do that during the session. That said, I will now pass it over to Allison Hargarden and Lisa Schluter, who will be conducting our workshop today.
Thank you, Angela. And hello, everyone, and thank you for joining us today. We hope you have enjoyed your conference experience thus far and are excited that you have chosen to take your afternoon to learn more about the Colorado model of early childhood mental health consultation. My name is Allison Hargarden, and I am the Early Childhood Mental Health Program Manager with Colorado's Office of Early Childhood. And I am joined today by my colleague, Lisa Schluter, who is the Early Childhood Mental Health Strategy Lead under the Preschool Development Grant, also within the Office of Early Childhood. During today's workshop, we will briefly provide an overview of Colorado's history with early childhood mental health, which I will refer to as ECMH throughout the rest of the presentation. We'll also share information on recent initiatives to develop a high-quality standardized model of consultation, provide an overview of Colorado's essential elements and theory of change, and highlight how we are overcoming challenges to build continuity and alignment statewide. We hope you leave today with new perspectives and additional context and tools in which to assess the equity and sustainability of your own developed or developing models. So we wanted to begin with a quick poll to understand who is in the audience today. So if you could all just take a moment to indicate your role so we can better understand what brings you here today. All right. All right, so I believe everyone can see the poll. A lot of consultation workforce, which is wonderful, program state administrators, and then a bucket full of others. So I hope that we can address everyone's needs and intention of being here, but thank you all for joining us. All right. So starting out with Colorado at a glance, Colorado is fortunate to have a deep history in infant and early childhood mental health, as well as a strong bench of early childhood mental health experts. We were an early alliance for the Advancement of Infant Mental Health State Association and have benefited from 2 project launch grants across time. Additionally, Colorado has received substantial funding and advocacy from philanthropic partners. We have had a statewide consultation program that has been funded through the state and with federal dollars for nearly 15 years. Throughout this time, the Colorado program, which is administered out of the Office of Early Childhood at the Colorado Department of Human Services, has been following national guidance and working toward a sustainable developed model of consultation. In the spring of 2020, legislation, specifically House Bill 20-1053, passed that accelerated this effort by requiring the state to develop and implement a formal model of ECMH consultation on or before July 1st of this year, 2022. Additionally, the consultation program was recently awarded additional funds through Senate Bill 21-137, which has positioned us for a completed program evaluation by 2026. Outlined here is House Bill 20-1053 Part 4. This piece of legislation addresses broader supports for the early childhood educator workforce with Part 4 being dedicated to developing and implementing a model of ECMH consultation. This legislation codified the program into law and requires that the program include a model of consultation by July 1st, 2022, that outlines clear quality mental health consultants, specific job expectations, expected outcomes of the program, and specific guidance on ratios between mental health consultants and the settings they support. It specifically calls out the need for the model to be stakeholder informed and built on evidence-based practices. As a first step to building a model of consultation, we took a look at other ECMH programs across the country, and we wanted to know more about which states had a defined model of consultation and who was engaged in evaluating that model. So please note that the chart here reflects findings from interviews and best available data in 2019. It is likely that many states have shifted columns in the last 2.5 years by either opening a consultation program, starting or closing an evaluation due to access to new funding. In 2019, as you can see, Colorado was categorized as a program in development, the second column from the left. The states that are flagged in blue indicate those states that are closest to us geographically and demographically. With this data in hand, we had to ask ourselves, as a state that invested in early childhood mental health consultation early on, how did we fall behind in developing, implementing, and evaluating a model of consultation? Unfortunately, what we landed on was limited funding, which I'm sure is a reality for many of you here today. Since the program's establishment nearly 15 years ago, we have been fortunate to have stable annual program funds supported by state general funds and federal child care and development funds. However, these funds have been nominal compared to other early childhood programming, as displayed in the graph. Of the total funding allocated to the 3 programs listed here, ECMH received only 3% of funding and has chosen to use these dollars to capitalize on boots on the ground. With the majority of all program funds going to support regional consultants, Colorado's investment in workforce development, infrastructure, and evaluation has been severely limited. Colorado has been able to accelerate the model development work and add valuable partners through new funding, namely the Preschool Development Grant Birth to 5, and more recently, Senate Bill 21-137, which has charged us to evaluate the program by 2026. As many of you are well aware, you can evaluate a model before it's developed, so let's take a look at Colorado's developing model. Before we dive into Colorado's model development process, I wanted to pause and see where everyone here is with developing a model of consultation. Please take a moment to indicate your state's, tribal nations, or territory's stage of model development. "66 responses. I'm going to go ahead and end it and then share the results. So it looks like we have definitely some diversity of folks who've joined here today. So some people in that developed and evaluated, majority of people sitting in program and development, and then lots of folks in between. So hopefully we will have different takeaways throughout this presentation to help each individual in these different phases have at least one takeaway as we move through this. Okay, let me get back here. Okay. So as we share the work of Colorado, we will leverage the Center of Excellence's 4 essential building blocks to frame our progress since spring of 2022. So beginning with eligibility. When the program was first established, the age of eligibility was birth to 8 years, aligning with other programs in our office. We have since moved away from an educational definition and rather aligned with the field on the definition of early childhood as birth to 6, including the prenatal period. Regarding geographic region, since its inception, the Colorado program has had statewide reach. We have observed inequities in access due to the geography of Colorado, as we serve both rural and urban areas, each with varying and unique needs. We will briefly address this challenge later in the workshop. In terms of service delivery, consultation in Colorado has been accessed almost exclusively by licensed early care and learning programs. However, both recent legislation as well as the pandemic have shifted what support looks like across the state, with consultants meeting the needs of children, families, and providers where they're at, regardless of their setting. We have also seen some intentional and promising investments from home visiting to add early childhood mental health, known as enhanced home visiting. Apologies. Moving into service design. Through deep stakeholder engagement, we arrived at broad recommendations for frequency, intensity, and duration of early childhood mental health consultation services. These dosage parameters are captured in the report linked here, which is also accessible to everyone in today's participant handout. The average case length of a child-focused case is 6 months, and classroom and program cases run 9 to 12 months on average. Given the program's roughly 15-year existence, arriving at agreed upon recommendations that responsively meet the needs of children, families, and providers, while also being adopted by practitioners, administered to fidelity, and subject to evaluation, was hard work and really highlights the dedication of the early childhood mental health workforce in Colorado. The model implementation advisory team, which included 12 members representing rural and urban settings with a variety of experiences and roles related to ECMH, has been instrumental in informing service design and the model overall. You can learn more about the process for collecting this information in the Stakeholder Informed Service Model Report. Consultant capacity is tricky, and understanding caseload has been a challenge for us. If you were on the last panel as well, I think this was talked about and it really highlighted some of the challenges that we're experiencing here in Colorado as well. There are 2 factors that have made it hard to say for certainty what works best for consultants and clients. First is that Colorado has only recently established and implemented dosage parameters for service delivery, and limited data exists to appropriately understand outcomes. And second, the state has varied topography, both rural and urban, along with varied staffing at ECMH sites across the state. Given these factors, identifying ratios that work for all consultants statewide has been difficult. We are working with our analyst team to determine these recommendations now. Lastly, we have been working to increase equitable access to ECMH consultation services across Colorado. As I'm sure many of you experience, factors such as stigma, consultant turnover, overall awareness, and ability to meet the demand for services, particularly in expansive rural areas, has resulted in differences in access. To help address inequities, Colorado has most recently launched an online referral system and an early childhood mental health support line. The participant handout shared with you today includes links to these referral sources, along with additional information and promotional materials. Workforce. Our workforce recommendations closely align with the Center of Excellence and other states who administer consultation programs. As shown here, we require consultants to have completed specific trainings, all of which are funded by the state. Consultants are required to meet specific qualifications, including degree attainment and endorsement, as well as receive reflective supervision from a qualified reflective supervisor. It is worth noting here that Colorado faces workforce shortages, including issues with recruitment and retention, which we will address briefly later in this presentation. And I'm going to hand it over to Lisa.
Thank you, Allison. We provided a high-level overview of the first 3 building blocks needed for program development: eligibility, service design, and workforce. But what does it mean to develop, implement, and evaluate a model? Here you see the steps to building evidence developed by our evaluation partners, Colorado Labs, and adopted by Colorado State to assess evidence-based programs and funding requests for those programs. Annually, Colorado state-funded programs who wish to renew their budgets must identify and submit the step at which their program lies on this continuum. As the program moves through the steps, you see a departure from theory-informed to evidence-based to proven. Step one is really looking at those program parameters or program design alone. So what do you put on paper? Those last couple of slides that we saw, what's the age group, where does it take place? And then step two is really looks at process. When you get to step 4 and 5, you're determining if the program implemented to fidelity accomplishes what it set out to. So in our case, whether it builds adult capacity, improves children's social, emotional, and mental health outcomes, and so forth. So step 4 and 5 tell us, is it effective? Or whether those outcomes are essentially equivalent to no receipt of services or no intervention, so essentially ineffective. And then also, very importantly, whether or not receipt of services results in any harm. So you need to figure out, as you're building evidence for any program, whether it is effective towards the end in which it is hopes to be. So what are those outcomes? Whether it is no different than not receiving services, and then also making sure you are doing no harm. When we approached Colorado Labs this time last year, we had a few components on those first 3 steps, but each were in need of further definition and strengthening. Currently, we are closing out step 1 in line with the charges of House Bill 2010-53, Design a Model of ECMH Consultation. Step 2 will begin this summer, and step 4 is anticipated on or before August 2026, when Senate Bill 137 requires us, Colorado, and the Department of Human Services to demonstrate the ECMH program's impact and efficacy. And though Colorado, as Allison outlined, has had a funded program for many years, each of these building blocks needed attention to ensure that the foundation for effective implementation was possible. And arguably the most time this last year was spent on the building block of infrastructure. So one of the very first undertakings of Colorado Labs in partnership with Urban Institute last spring was to review all the seminal materials around infant and early childhood mental health consultation. So thinking through what the Center of Excellence has listed in their resource section around workforce and program development and evaluation, what was in the scientific literature, and what is being done by other programs in the country. They then developed a draft of the essential elements, and then they vetted that document with those doing the work. So they wanted to understand 3 critical components. Really, what were the principles or what assumptions is our consultation grounded in? Then that context and structure. What does implementation look like? And finally, the consultation practices. What do consultants do in their day-to-day work? Urban Institute engaged each and every state-funded site in Colorado providing consultation services, team leads, supervisors, consultants, to understand what these essential elements were. Or in other words, what were the core functions and active ingredients necessary for the program to produce its desired impact? We're going to take a look at that essential element document. So much of what you see within this document should really resonate with the folks on the call. I saw a lot of the workforce and a lot of program administrators. This is a foundational document that was critical to informing the theory of change. So as it's organized, you'll see in the top left the principles. So these items look like building adult capacity, being based in relationships, prevention, not about fixing kids. And then to the right, you'll see the context and structure. So the who, when, where. And at the bottom, you see those consultation practices that really get at how is it done? What are those active ingredients, and how in the day-to-day practice do consultants impact the clients they're serving to arrive at those positive outcomes that we all know are meaningful in this space? But how do you get from showing up every day and working with a client to improve social, emotional, and mental health in children, increase capacity in adults? So these consultation practices form the base of the theory of change, which we'll review next. And they're believed to be those active ingredients that are necessary for the program to produce its desired impact. And really those steps 4 and 5, what we're hoping to get at in 2026. So next we'll look at that theory of change. So the theory of change is all about making the implicit explicit. We know these things, but when you document them and you put them out there for consumption by consultants, by other state program administrators, by our analysts, by key stakeholders, you start to build more of a conversation and you can refine it and build towards our logic model and eventual evaluation. So at the base, you'll see those consultation practices, as I had mentioned in purple, that come from the essential elements. And then you're documenting the steps between those day-to-day consultation actions and their intermediate and long-term outcomes that the program aims to achieve. Early childhood workforce retention, reduced suspensions and expulsions, things like that. So how do you get from simply saying we serve kids who are age 6 in any setting that kids learn, thrive, and grow to and having qualified consultants to actually eliciting and observing those changes that you want to see in the early childhood landscape. So for example, in the teal, right above consultation practices, you will see that we posit you must effectively change attitudes, beliefs, as well as knowledge and skills before you might expect to observe a behavioral change in the classroom. These are all linked in the participant handout for anyone to take a look at further. As I mentioned, it's not terribly new or innovative in the sense of recreating consultation. It's really looking at how has Colorado already done it for 15 years, what's best practice, and how do we get from step 1 to step 4 and 5 by really documenting, understanding, and being on that same page around how consultation works to elicit positive outcomes for adults and children. So again, it's worth saying you cannot simply define a model and consider it implemented or effective. So we'll turn to the slide deck, thank you, Allison, and close out on that building block of infrastructure. And then I'll hand it back to Allison and we'll provide some examples of needed supports and ongoing barriers to building the steps of evidence for Colorado. As noted here, our logic model is in progress, and understanding those inputs and outputs will be critical to work towards program evaluation. And service organizations, on the previous slide, the program is administered out of the Colorado Department of Human Services, Office of Early Childhood, which will be transitioning to the Colorado Department of Early Childhood this summer. And consultants in the field are employed at both community mental health centers as well as early childhood councils. We are fortunate to have a very strong private-public partnership, and most recently, Colorado was able to add a network hub, which Allison will speak to a little later, or you can also hear from the hub directly tomorrow during their poster presentation at 11 a.m. Eastern. And then as the last piece of the infrastructure puzzle for this fiscal year, we plan to release a ECMH program manual. And this will essentially outline the program's policies and procedures from onboarding and supervision and performance requirements, as well as support the fidelity implementation of this refined model. So where do those who are expected to implement the model find all the details and expectations, as well as that recipe and the active ingredients, so that we can move from consultation practices to expected outcomes. This is an effort that's been informed by our implementation and evaluation partners, Colorado Labs, as much as feedback from key stakeholders. And most recently, we were fortunate to partner with IRE for review and refinement of the materials that we are developing across all these building blocks to ensure that EDI principles are reflected. Equity, diversity, and inclusion. Here, we just wanted to simply outline that we have been actively engaging our stakeholders since House Bill 1053 passed in the spring of 2020. So we're very proud of the work to date, and we will continue to engage our stakeholders as we roll out the model and work towards effective implementation and program evaluation. There's also additional infrastructure to consider, and the components listed here, from the data system to marketing to external evaluation and governance, will all be essential to implementation and building evidence, and we will dive into these in more detail in the coming slides. So before we move on, to the nitty gritty of how are we doing it, how have we course corrected, what's working, what's not working. We want to take a quick poll and figure out which essential element of the, which building block has been the largest challenge for your state, territory, or tribal nation. Yeah, workforce. You're not alone. Funding is huge. Yeah, I understand, Amy.
It's definitely been a perpetual theme through the presentations I've heard thus far at the conference, just around funding really influencing workforce and some of these other components. Well, we will dive into a few of these. These have also been barriers for us, and some of them have also been support. So thank you all for sharing what you're experiencing as well. Okay. All right, so now that we've outlined the development of the Colorado model, we wanted to take some time to share what supports and challenges we have faced as we have begun to roll out the model and develop clear, consistent, and aligned messaging across the state of Colorado. So this sort of reflects the poll that you all just completed. As demonstrated in the Venn diagram, Colorado has experienced more supports than challenges throughout the implementation process. We'll go over a few of these supports in more detail, specifically marketing materials, public-private partnership and governance, so some of that infrastructure component in the next few slides. And we'll also address a handful of the challenges that we faced, including ways that we've overcome stigma, worked toward clear role definitions, and addressed workforce recruitment issues, which clearly seems to be a theme for those here today. As noted in the middle section of the Venn diagram, some components of implementation have been both a support and a challenge for us. For example, our workforce has been instrumental in informing the model, yet we continue to face issues with recruitment and retention. Similarly, our data system, which we unfortunately will not have time to dive into in any detail today, has allowed us to tell our story, yet causes frustration for our consultants as we update and streamline the data entry process to reflect our new model. So the following slides are intended to provide an overview of the resources and supports Colorado has created or leveraged to capitalize on strengths, address challenges, and build alignment statewide. So let's start out with some areas of support, and these include marketing materials, so part of that infrastructure. A lot of time and energy has been dedicated to communicating what early childhood mental health consultation is to communities across Colorado. Building a shared awareness of ECMH consultation has been key to increasing equitable access to our services, as well as working toward model fidelity. These 4 newly created resources demonstrate the importance of raising awareness and understanding of our services across early childhood settings. Each of these materials, so our ECMH webpage, our overview flyer, our frequently asked questions, and our consultant bio, are available in both English and Spanish and are linked in today's participant handout for your reference. Excuse me. Continuing with marketing, creating a shared understanding of the ECMH model among our own ECMH workforce and partners is equally as important when looking towards continuity, alignment, and fidelity. We currently leverage a variety of communication platforms to achieve this, including a quarterly early childhood mental health consultation bulletin that is shared with ECMH partners statewide. We also use Chatter, which is a social media platform embedded in our data system that allows consultants to connect with one another, as well as with the state team, and address issues related to service delivery, equity, diversity, and inclusion, the data system, onboarding, really any topic, question, or resource. It's a really great platform to share on. A biweekly communication is also emailed to all consultants across Colorado and includes updates on webinars and trainings, the data system, equity, diversity, and inclusion initiatives or resources, as well as model updates. We also hold monthly community of practice meetings, which are attended by all of our state-funded consultants, and anyone across the state of Colorado participating in consultation is encouraged to attend. And lastly, a program manual, and this is anticipated to be released along with our model this summer in July of 2022. Colorado has also worked to create systems coordination and alignment across workforce, partners, and clients. A few of the examples are listed here. So the state holds monthly lunch and learns for our early childhood mental health workforce, where early childhood partners share information on their programming. Recent lunch and learns have included presentations and discussions on special education law, implicit bias, updates to Colorado's early intervention program, and many more topics. Additionally, we work to actively coordinate and align with other state agency programs. These include our state's early care licensing team, early intervention and child find, the preschool to third grade office at the Colorado Department of Education, and the Colorado Department of Public Health and Environment's screening and referral process, among many others. Similarly, we provide opportunities for alignment and coordination with our partners such as Right Start for Colorado, who's our infant and early childhood mental health initiative funded through SAMHSA, and the Colorado Association for Infant Mental Health, our Alliance State Association. Lastly, coordination and alignment with our clients is also critical. We have worked to strengthen a shared understanding of ECMH consultation by creating a Colorado Shines Early Childhood Mental Health Consultation video, which is linked here, and a Professional Development Information System, or PDIS, e-learning course titled Working with an Early Childhood Mental Health Consultant. This course was recently added to Colorado's licensing rule, requiring that all directors and assistant directors of licensed early care and learning settings complete this course within 90 calendar days of employment. As Lisa touched on, Colorado has been fortunate to create a strong public-private partnership with Healthy Childcare Colorado, who was recently awarded as Colorado's Early Childhood Mental Health Consultation Network Hub. This network hub will work in partnership with the state of Colorado to support consultants through training, technical assistance, and professional development. The hub is currently in the process of developing its core functions, priorities, and activities. And to learn more about the development of the ECMH Network Hub, please join their poster presentation, which is taking place at this conference on March 22nd from 11 to 11:30 and is titled Building a Sustainable Early Childhood Mental Health Consultation Network Hub, Highlights from Colorado. And then to address some of our other challenges around role definition and pipeline, Colorado has leveraged various funding sources for special projects. The ECMH program is currently participating in a consultative roles work group, which is funded under the Preschool Development Grant, which works to clarify roles among Colorado's early childhood helpers. And this includes child and adult care food program specialists, child care health consultants, continuous quality improvement coaches, infant toddler specialists, and ECMH consultants. This work group also identifies opportunities for teaming and collaboration among our workforces. Additionally, we are using American Rescue Plan Act funds to explore workforce retention and recruitment strategies, including paid internships, loan forgiveness, and other education costs. Our hope is that these supports will roll out in the coming months and help support recruitment and retention of our workforce. Lastly, addressing stigma is an ongoing effort that consists of constant awareness, advocacy, and re-education. Colorado is participating in and supporting various projects and presentations to reduce or eliminate mental health stigma, specifically in early childhood, And we are thrilled to have the new Infant and Early Childhood Mental Health Consultation Network Hub to assist with these awareness and advocacy efforts. Current initiatives include the Early Childhood Mental Health Public Outreach Project, statewide awareness presentations, the DC 0 to 5 awareness presentations, and shareable resources and social media posts available on the Early Childhood Mental Health co.org website. And we were going to do a fourth poll. I'm not sure. There was some technical difficulties at the beginning with this one. Have we gotten the fourth poll set up?
The fourth poll is set up.
Awesome. So as we wrap up today's presentation, we wanted to take a moment to pause and reflect on the information shared. Our hope is that you all walk away with at least one new learning, and we'd love to see sort of what bucket that falls in. So please take a moment. Seeing a lot of learning in that service design and infrastructure bucket. All of them. Glad to hear it. Certainly our hope that you guys walk away with some things that you can take back to your teams. Looks like the poll has slowed down, so just going to share that. So a lot in the area of service design and then also within infrastructure. So creating a model of consultation in Colorado has been a huge lift, and we're incredibly grateful to all of our partners who have supported and informed this work, many of whom are also presenting at this year's inaugural conference. While there is certainly more work to be done as we roll out the full implementation of the model this summer, we are confident that our mighty team of partners can help us to do so effectively and efficiently. So thank you to everyone who has contributed to creating Colorado's model. So we've presented a lot of information today, and please know that nearly all of this is available in more detail in the resources linked to the participant handout. Both Lisa and myself are available for any follow-up questions you may have now or in the future. So please don't hesitate to reach out to us by email. And I believe we left several minutes for any questions. So happy to open this up to everyone for questions or discussion.
Justina has a question.
Sounds good. Yeah, feel free to pop anything in the chat, or I don't know if you can unmute yourself.
Thanks, I'll try this. Can you guys hear me?
Yes.
Hi, Justina here from Hawaii. I had a question about how you got some of the buy-in to do some of the, I mean, it seems like you've been able to do some really great upfront resource planning and kind of looking at the things you would need to be in your model ahead, almost ahead of implementation. And I feel like there's a lot of pressure to, you know, to basically get the consultants out there, but from what I can see, you guys actually have been able to do some work on like what resources are actually needed to build the workforce to have kind of the model you need across Colorado. So I wondered if you could speak a little bit about that.
I can address that a bit. I think I would say don't be discouraged. We have been providing consultation in the field for over a decade without these steps. So you can build the plane while you're flying it. If you all have access to slow that down a little bit, it's a lot easier to build it than implement it. but you can certainly start to solidify and round out some of that standardization and those really important messaging components and build the data system and such as you're going. So we are actively doing both. I don't know if that helps you or not, but we have folks in the field every day. They'd like to know where that program manual is. So we are doing both.
And I think to just add on to that a little bit, so I actually just joined Office of Early Childhood about a year and a half ago. So I've really only joined since this model has been sort of in development, but having come in here before that, right, everyone is out there doing such amazing work across Colorado, and it was all similar, but also not, super defined, right, and making sure we have alignment and coordination. But it really was all that work that was being done in the field that has informed this. So we have really made efforts to do focus groups and collect all this information from the people doing the work so that we know what's working, we know what gaps there are. And that has really helped us identify where these resources need to be built out, what needs to be, now versus can maybe hold off until a little later. So hopefully that's helpful. I saw a lot of love in the chat for some of the resources that we were able to share. And again, please don't hesitate to reach out to us if you have any, questions about how those were created or, things to adopt or things that have been working well for us. We're happy to answer some of that as well.
So we have a couple of questions rolling in, Allison, that I'll punt to you. We have one question around endorsement generally, how we think about it, how it's included, is it part of our workforce? And then a second question around whether or not there's grant money to help people go to school for consultation.
Yeah, so regarding endorsement, we do require that all consultants are either in the process of becoming endorsed or are endorsed. We work very closely and collaboratively with the state association who holds office hours to really help support our workforce in navigating that process. A lot of the feedback we do get is that it's intimidating. There's a lot of different paths to go down and really needing some support in exploring what is the correct path for endorsement and then really having some guidance on as they progress through that. So we do require that based on, people's general populations that they work with. We only require early childhood or infant mental health endorsement, with some of our consultants electing to do both over time. So yes, that is one of the requirements for our workforce. And then regarding grant money to help people to go to school, we are interesting in Colorado in that, again, very public-private partnership. So the state of Colorado requires that consultants hold a master's degree in a mental health field that is license eligible. We also have a lot of philanthropic funders within Colorado who support early childhood mental health consultation, particularly providing funding for rural communities, which are often hard to serve and, hard to fill those positions, hard to fill positions. And they actually have different requirements where they require a bachelor's degree in a mental health field. So we are exploring ways to support, both like grow your own pathways, as well as some of those who are, would love to pursue their mental health degree using some of those ARPA funds. We don't have anything outlined right now, but we are in the process of exploring like an exempt form that would allow people to indicate their current qualifications and then how they'd get from one step, like a bachelor's degree to a master's degree, or get certain trainings with certain funds, should they not qualify as that master's level licensed eligible upon hire. So we're certainly trying to get creative with some of our workforce pipeline in both financially supporting them with some of these stimulus funds, as well as sort of creating pathways and partnerships with higher ed to, support consultants in getting those qualifications.
All right, this was great. I think we are just, I have a few minutes left. Or are we out of time?
I think we have a few minutes. I think it's to the 55.
Yes, we have like
If there are any
3
other
or 4 minutes
questions.
left for final questions.
Susan, I see your hand up.
Yes, hi. I work in mental health consultation in Illinois, and I was just curious about your reflective supervision structure, I guess, is maybe my question. Just how are you regularly providing that reflective supervision for mental health consultants? I know that's something that we have in place in our state program, but it can be kind of tricky at times, just in terms of who's available to do that at a certain level of quality. So I just wondered if you could speak on that.
Yeah, so how our program is set up is we hold various contracts with different sites across the state of Colorado, which Lisa shared. Most of our early childhood councils and our community mental health centers. And so we do put it in the contract that it is required that consultants receive regular reflective supervision from a qualified reflective supervisor. And so to support that, we do fund it as a state. So all sites are able to put a budget line in to receive that support. And then it really is up to the individual sites across the state who house these early childhood mental health consultation teams to oversee that their consultants are receiving that reflective supervision. Again, we partner a lot with our state association, who has a list of qualified reflective supervisors that our teams are able to leverage. And since the pandemic, a lot of our teams have participated in virtual reflective supervision, which has sort of opened up our door to not needing to have something local, but really be able to either receive that reflective supervision from somebody across the state of Colorado or even outside the state of Colorado. Our only requirement is that they are endorsed qualified reflective supervisors themselves. So we help fund it, and then we have our sites actually oversee that is taking place per the contract. And then Lisa, let me know. I see some action in here. I don't want to readdress anything, but let me know if there are questions I've missed.
I think we're good. A couple questions around which legislation has been most useful. A lot of folks saying thank you for the participant handout and the nice organization. And lots of questions around just how do you get statewide coverage, who's overseeing it, which I believe you just answered. Yeah.
Yeah, so we currently have 22 different contracts that we hold across the state of Colorado. Again, mostly early childhood councils, community mental health centers, and we do have some nonprofits as well. And again, they each hire their own team with, again, those are different sizes, sort of what we talked about. Some of those difficulties with ratios is that some areas have bigger teams. And again, it is sort of proportional to the demand or the need, number of children, families, and providers in the area. But we do cover all 64 counties across the state of Colorado through our 22 contracts that we hold. Let me know if there's any follow-up questions there.
I think this is where we thank everyone for their time. And Angela has also invited folks to sign up for the Center of Excellence resources. We have been receiving technical assistance through the Center of Excellence and continue to reference their website. We are very excited for this conference and hope to learn some things ourselves. So keep it coming. We all have things to learn.
Yeah, thank you so much, everyone. Again, emails are there should you have any other questions, but we hope you enjoy the rest of the conference and have a great week.